All right, everybody, I think we're going to begin. So welcome. Happy afternoon to everybody, and thank you for joining us on our Duty to Cooperate webinar on getting creative with accommodation. My name is Katie Clark. I'm a communications advisor with the Workers' Compensation Board of Nova Scotia. And I'm joined today by our Vice President for Prevention and Employer Engagement, Tracy Newman. And if you've been part of our webinars on Duty to Cooperate, then Tracy is no strange face to you. And she'll be leading us through some opening remarks here in just a second before we move into the main part of our presentation, which is on getting creative with accommodation. And we have a special guest to speak about that today, and that is Val Royle. And Val is with Rock Disability Management. So she'll be leading us through some tips and tricks on how we can get kind of creative with accommodation and welcoming people back to the workplace in their return to work journey. So before we begin, though, a few things that are a little different today. We will have that part of our presentation, but we've also added an extra 15 minutes at the end of today's agenda to speak with the continuing care sector and answer any questions that they may have on return to work, due to cooperate, and accommodation. So if you are joining us today and you're a member of the continuing care sector and you have some questions for that part of the agenda, by all means, please pop them in the chat. We'd be glad to answer them. So that will be the extra 15 minutes at the end. So today's presentation is actually going to go until 4:15, and everybody is welcome to stay on for that part of the agenda. Given saying that, we will still have our regular Q&A after Val's presentation as well, just to clarify that. A couple of housekeeping items. You probably know the drill by now. Your mics and cameras will be muted and turned off for the duration of the session, just to minimize any disruptions. The webinar is being recorded, and as usual, we always post the recording to our Duty to Cooperate page. And we also have our frequently asked questions now posted to our Duty to Cooperate page as well. So if you haven't seen them yet, you can head on over to check those out. And without further ado, I'm going to hand the floor over to Tracy Newman just to lead us through some opening remarks before we move over to Val. Floor is yours, Tracy.
Excellent. Thank you, Katie. And welcome, everybody. Thank you all for joining us. If you're here in Nova Scotia on a particularly sunny Thursday afternoon, it's a beautiful day out there. It's a great day to learn a little bit more about Duty to Cooperate as we prepare for our July 15th launch. The last time we were together on April 24th, we had a lot of great questions asked. Many of the questions related to the expectations that we here at the WCB will have a view as employers or workers when Duty to Cooperate comes into effect. So to support that ongoing understanding, today I've brought in an expert, Val Royle from Rock Disability Management, to talk to you about how to build a strong return to work plan to set yourselves up for success when Duty to Cooperate is launched. As Katie mentioned, Val is a consultant who specializes in disability management, and Val is also leading the training of all our WCB caseworkers to build a strong service model to support all of you. So together with Val, we'll also do some myth busting towards the end on some common misconceptions that relate to return to work and Duty to Cooperate. At the end, we'll conclude the webinar with the resources we've prepared to support you and the next steps with Duty to Cooperate readiness. And then, as Katie mentioned, we'll open it up. We'll have a chat in the webinar. And for those joining us from continuing care, we really look forward to the last 15 minutes that are set aside just on a continuing care focused question and answer period. So let's see. You guys are probably, if you've been along the journey with us, familiar with this roadmap. So here we are in June. And before I hand off to Val, I want to talk a little bit more about what we're going to cover in our next webinar. Or we're almost in June, actually. So in June, we'll start to further talk about what's in the actual policy. There's been a lot of interest in that. So we'll get to that kind of the nuts and bolts of what's actually in the policy and what you need to know in that June webinar. We'll begin to cover a little bit of the mechanics of the draft policy today, but we're not going to get into all of it. I can't emphasize enough that being compliant with duty to cooperate isn't going to be difficult. And I'm hoping that's what you take away from today. Our expectations are that you can do everything in your control to cooperate in the worker's return to work process. And this expectation's made a lot easier when you have proper planning in place. And that's what Val's going to really concentrate on. So with that, I'm going to hand you over off to Val to take it away, and then I'll be back towards the end. Val?
Awesome. Thanks so much, Tracy. Hello, everyone. I am coming to you today from the shared traditional territory of the Kwalendon First Nation in the Ta'an-Quechin Council. I'm in Whitehorse, Yukon. I know most of you are on Mi'kma'ki today, and we'll just take this moment to recognize where we are. It's a beautiful sunny day here as well, and these territories that I am currently on have been stewarded by Indigenous people for generations, and certainly appreciate that stewardship. So a little bit about me. My background, I started with workers' compensation in Newfoundland and Labrador. I was executive director there, and we implemented duty to cooperate. I was president and CEO of the Yukon Workers Safety and Compensation Board, where we also introduced duty to cooperate. So I've been through this twice. This is my third time. Third time is the charm on helping to lead WCBs and stakeholders, employers and workers, through the process of implementing this type of legislation. So I'm really excited to be here with you today. I'm part of the International Disability Management Standards Council, helped develop the actual credentials for certified disability management professionals, as well as certified return to work coordinators. As part of the Academic Council for Pacific Coast University of Workplace Health Sciences. So, workers' comp and return to work it's my thing. I'm a little bit of a WCB policy junkie, but I hope that I can bring to you some more practical applications with respect to duty to cooperate and bust some of those myths about, how this legislation is going to impact you. I hope that I am truly preaching to the choir today about the importance of recovery at work, that workers recover better when they recover at work. Now, we're not talking about the exceptions of catastrophic injury. So let me just kind of park that. There are, unfortunately, some types of injuries where the worker has months in hospital or rehabilitation centers. And that's when we're talking about early and safe return to work under the duty to cooperate, we're not talking about those catastrophic injuries. But for the rest of the physical injuries, that is what we're talking about today. That's where my expertise is, and that's what I hope to be able to bring to you. The goal is for workers to return to work and recover. That is going to get you to a place where you have a vibrant workforce, you can increase your productivity, and your WCB rates will actually reflect that success. If reducing WCB rates is your purpose versus having workers recover at work, you're probably going to be less successful. But trust me, in other jurisdictions where this has been implemented, employers see reductions in their rates as an outcome of really good disability management practices. I will also say that before you have to manage a disability, the number one thing is to prevent injuries and illnesses from happening. So please, please, please continue to invest in your occupational, your workplace health and safety programs to prevent physical and psychological injuries. Okay, I'll get off my soapbox and get into it. Okay, I'm back on another soapbox, in honesty. So the best early and safe return to work planning honestly happens before an injury occurs. When there's an injury, you have, there's a whole lot of other emotional elements that happen. Worker is anxious, they may be in pain, they're uncertain about what's going on. You've got to figure something out. So if you have a really good return to work program in place that gives you direction on what to do when there are injuries, that is fantastic. You may want to take this opportunity in the coming weeks as the policy gets released next week, is to look at, is there anything there that maybe your program needs to be tweaked to ensure that you can meet the duty to cooperate? It's a great opportunity. If you are a small employer and you don't have a program, then my advice is to make sure you have a good return to work policy. And this isn't scary. This is a one-page document that says, if someone's injured at our workplace, as an employer, we're going to work with you to enable you to safely recover at work. It sets expectations and starts your duty to cooperate right from there about working with your worker. So I would also recommend that you design your programs and your plans for the majority of the injuries. The majority of the injuries WCB receives claims for in a given year are sprain strain injuries. Almost 67% of claims are sprain strain. So WCB has taken the approach to engineer things for the majority of claims. And again, those catastrophic claims are fortunately the exception, and they will be dealt with that way. But for the majority of claims, this is pretty straightforward. So design your program for the majority and incorporate the duty to cooperate in language into your programs as appropriate. I would also say when you're looking at your programs, have a look and see, are there any friction points right now that are causing you delays in your process? So one that I have seen in some of the claims that I've looked at in my role with WCB right now is that there's often internal approval processes with employers that take days or weeks. So you want to look at early and safe, and the early is really important. Every day matters here. What parts of your program are causing friction? Can you reduce those approval times? If a supervisor on the floor can get a return to work plan in place for someone, can they do it and start? Or does it have to wait a week for an approval from corporate? If it does, you might want to look at how can you remove those. So let's look at the duty to cooperate and think about how you can make your program better. The piece that I love about this legislation is that it's actually balanced a bit with an employer obligation and a worker obligation. Most of the sections of the Act aren't like that. This one is. And really, it boils down to these 4 points. This is what the Act says. The employer's duty is to contact the worker as soon as possible after an injury. Like, these are your employees, so contact them. It's not harassing someone to contact someone. Again, in a catastrophic case, someone's in hospital, they're in a coma, that's a little bit different. But for the majority of cases, making sure that you reach out to your worker as soon as possible after an injury occurs is important to start setting expectations about recovery at work. The worker, on the other hand, has to contact their employer. So this should help you with injury reporting, right? So the employer also has an obligation here to report and contact as soon as possible after an injury. So pretty equal, right? And pretty balanced, those two requirements. The employer has to maintain communication with their worker throughout return to work and recovery, and the worker has to maintain communication with their employer throughout early and safe return to work and recovery. That's a good thing. I know in the past, I have in my years of experience, there's workers like, I don't want to hear from my employer, they're harassing me. And it's like, no. This is really important. Maintaining connection to the workplace during recovery, even if the worker can't be there physically in a return to work plan, although with a little creativity, as we'll talk about, you can be, that's a good thing. And so maintaining that communication with each other is really important. The employer's obligation is to attempt to provide suitable work that is available and restores pre-injury earnings where possible. And the worker's obligation is to assist you in that endeavor as requested or required. Pretty reasonable. And finally, both the worker and the employer need to give the WCB information for return to work to enable it to happen. So again, this is fairly balanced. I know sometimes people get a little bit fussed. No, that's probably not the right word, but a little bit focused on, oh my gosh, what are the penalties? The penalties to the employer are so great. The penalties to the worker actually occur through a different section of the Act, but they're pretty significant too. But I would say focus on meeting the duty to cooperate. It's really about communication and working in good faith to enable someone to recover at work. So that's the crux of it. It's not scary. It's a little bit odd in Nova Scotia because the reemployment obligation came in years ago and separate from the duty to cooperate, where usually these come in play hand in hand. But you know what? That's okay. Duty to cooperate actually is a pathway to help you if you do have a reemployment obligation for a worker. So, they do work together. The duty to cooperate, however, applies to everyone, and it is a pretty straightforward duty about talking to your workers, working together toward early and safe return to work. So let's see how easy this is, because I will say that return to work happens all the time, and it happens all the time, particularly when WCB is not involved. So in the chat, my friends on this call are going to post a link to a document that has some information for you that we're going to talk about. I want you to forget about WCB, and I want you all to assume the persona of Carol. Congratulations. Now you're Carol. Carol is 40 years old. She can be female. He can be male. They can be gender neutral. It doesn't matter. Carol is a home care attendant, and Carol's work has been determined at the highest level to be medium. So we're going to talk about that because there are a number of different types of activity levels in work, from sedentary to light to medium to heavy to very heavy. And oftentimes we rate a job at the highest activity level, and it's important that we do that. But many jobs have different activities. Some are medium, but there may be some that are sedentary. Maybe there's some that are light. Most jobs do have a variety of things, but when we're thinking about how long recovery to pre-injury duties might take, we need to look at the highest one. But when we're thinking about return to work, we're going to look at all of them. So you're Carol. You are in this job. You finished your work on Tuesday, and you decided that you were going to do some gardening because you love gardening, and you're out carrying quite large bags of mulch, and you end up spraining your back. And you're feeling that hurts a lot. You phoned in sick yesterday, but today you want to get back to work, and you're thinking about your job, and you're going to go to your employer, and you're going to say, hey, employer, here's what I think I can do. So some information to help in that thinking. Carol, based on the medical disability guidelines, and I'm going to talk about a little bit later what those are and how to use them, but basically they're guidelines that talk about the normal recovery time. And so for an injury like Carol's, she probably requires like 6 physiotherapy treatments over an 8-week period. And the disability duration guideline, which is the kind of expected recovery time for the average person, is actually 21 days for someone to get back to full medium duties. So in your handout on, I believe, page 2, you could see that while it takes 21 days for Carol to get back to medium duties, she can actually return to sedentary duties within 1 to 3 days. So she could start sedentary duties right away. Sedentary duties are described in your handout as well. So they are duties that basically, it's really your regular activity of daily living. You're not going to lift more than 10 pounds. You can sit or stand as you need, right? So she could start sedentary duties right away and then move to light and medium. All right, so my challenge to you, and we're just going to take a minute and read through, and I want you to think about Carol. You're Carol. This is not workers' comp. You've got a list of duties for Carol in your package, and I want you to think, you are Carol. You're coming to your employer. Which of these duties do you think that you could do today? So probably things that are sedentary. You're looking for things that are sedentary. All right, hopefully everyone's able to open the link and look at the document. And as you're doing that, just in case some of you can't, because I can't see you, so I don't know if you can or not, let's think about something like the first duty that's listed is personal care assistance, which is helping patients with their activities of daily living and may involve lifting or supporting patients who have limited mobility. So is that something that Carol could do today, 2 days after her injury? No, that's not sedentary. So Carol, sorry, but you're not going to be able to do that work right away. What about feeding assistance? Helping to prepare meals and assisting with feeding patients? Maybe. That could be sedentary. Transferring and mobility, so helping patients move between the bed, the chair, or wheelchair. That's not sedentary. So Carol's not going to be able to do that yet. But can she remind patients about taking their medication? Yes. Could she do vital sign monitoring? Yes. Could she do housekeeping and errands? Maybe not right away. But Carol could go back to work today doing a couple of those duties. Right? And this happens all the time without workers' compensation involved. Usually the worker will come to the employer and say, I hurt myself, I want to come back, here's what I think I can do, for the next week, and then we'll work it through. Okay? So what if it was workers' comp? What if we have the same scenario, but Carol is now injured at work. She slips while transferring a patient from a chair to a wheelchair. Same injury, same treatment guidelines, and the same disability duration guideline, that it's going to take 21 days for Carol to be able to get back to doing medium activities. So what's changed? Injury reporting to WCB Nova Scotia, that's different than the previous example. If you have any internal workplace health and safety processes that you follow following an injury with respect to incident investigation, right, then you would do that. But from an early and safe return to work perspective, nothing changes, right? You're developing a return to work plan based on Carol's duties and her abilities. You have to get a little creative because she can't do all of those duties, but she can do some, and then she can build toward the other ones. I think what is surprising for a lot of folks here is that the expected disability duration guideline for someone like Carol with a low back sprain to get back to medium activity is 21 days. It's 3 weeks. This is not 3 months. This should not be 3 years. This is 3 weeks. So, there's going to be a return to work plan needed for a 3-week period of time. And maybe it needs to extend a little bit, but it shouldn't be a lot. All right, so we've got Carol back to work. So that's a good thing. Now, that was what you were doing. What's WCB Nova Scotia doing? Tracy talked about, I've been working and training with caseworkers on how to facilitate their early and safe return to work skill set in helping you to meet your obligations. In the first instance, the workplace parties, so employers and their workers, do return to work planning before WCB even gets involved. And if you already have a program, maybe you have a third-party provider, you have internal expertise, you develop a return to work plan, attach it to your injury report and send it in. And then WCB's job will be to look at that return to work plan and see, hey, can we help? Is this, can we help with this plan? Is this a reasonable plan? But you've already done the work and the worker's already back to work, we hope. If you can't, so if you're small or medium, or if you're stuck and you can't figure out a return to work plan, then the caseworker is going to help you, whether that's an adjudicator or a case manager, is going to help you develop an early and safe return to work plan. So they will help you. They have templates, they have expertise. They're going to work with the worker and with you as the employer to develop that plan. And you know what that does? Meets the duty to cooperate, right? You're giving WCB information. You're working toward providing suitable and available work. You're communicating with your worker, the worker's communicating with you, right? And you've worked together after the injury to make sure things are reported to each other. So this process will help you with that. But really, if you need assistance with return to work, report, I would suggest you do that right away. In any case, I know the WCB Act in Nova Scotia gives employers 5 days. But, if you can report that injury within 2, the faster the processes can move, and WCB can provide assistance if that's what you need, or can provide confirmation that you are on the right track and everything is going really, really well very, very quickly. Okay. So when WCB gets a plan from you, and right now this is taking about 7 days. So it's taking about 7 days from the date of injury for an employer to report and for that claim to be assigned to a caseworker. So think about Carol. Her disability duration guideline was 21 days. A third of it is already gone before a WCB caseworker even gets involved. So if you're not starting return to work at the workplace, it may not be happening for a week, and lots of things can happen in that week that can end up delaying things down the road. So really important to get reporting in place, really important to have, if you're a large or medium-sized employer with a return to work program, that you start return to work right away. And when in doubt, offer sedentary duties to a worker, because those are generally safe. They're at a very low level. They're basically mimic your activities of daily living. one of the principles that WCB is following here is from the American College of Occupational and Environmental Medicine, and they're called the SPICE principles. These might not be new to you. You've probably heard them before. WCB Nova Scotia has actually been using these for many years with a renewed focus now with the duty to cooperate. And some of this can help you start thinking about how do you get creative in return to work. The S in SPICE stands for simple. Keep things simple. Deal with them before they get complicated, which means early. That's the early part. And try not to use jargon. And I know, and I've got colleagues here from WCB Nova Scotia. Sorry, guys, but my gosh, WCB Nova Scotia has created its own language, acronyms. They've even made up words like TURB. Like, that's not even a word. So if you're developing your own program, don't do that. Like, try to make things simple. Call them what they are. Keep it simple. Deal with things when they're simple. Keeping the worker proximate to the workplace is critical. So ideally, the worker is back to work in some capacity while they recover. But if they can't be, keeping them connected to the workplace is really important. Immediacy, as I said, getting things done quickly is critical because, again, the disability duration guidelines for these types are really short. So we want to make sure that we can maximize that and enable safe recovery at work. Centrality means keeping the worker at the center, right? And that the worker is the person who was injured. So listening to their voice and including them in conversations about them. I hope that sounds familiar because it's one of the points in the duty to cooperate, right? Is talking to each other and including the worker. And then expectancy is an expectation that the worker is going to recover and return to work, within the normal guidelines. Again, they're guidelines, so they might have to be adjusted a little bit either way, but still, if everyone expects return to work tends to happen. I talked about the medical disability guidelines, and these are a tool that WCB Nova Scotia has had for a number of years, and again, there's a renewed focus on them. This is a branded product, and if you are not using it in your return to work program, I don't get any commission from MD guidelines, right? And there may be other things that you can use, but WCB Nova Scotia is using this. All of their tiered service providers are using these guidelines, and they are a rich source of kind of telling you how many days on average, like, should you expect someone to be able to get back to their pre-injury duties? So for Carol, it was 21 days to her medium duties, but it was 1 to 3 days to sedentary duties. So she just needed a day or two of rest and could get back to work. Many injuries don't require any days to get back to sedentary work. The worker can stay at work and keep on working in sedentary. So the MD guidelines are, I'm a big fan. Again, I'm not trying to sell you anything. I don't get any commission from them, but they definitely help you to look at how long is this return to work plan is going to be? How can I progress it along the continuum of recovery? And tons of information about various types of disabilities. It also enables you to adjust things. So, some of you might have workers who are quite older. I was just on a meeting last week where there was a continuing care assistant who was 79 years old and was injured. Now, obviously, 79-year-olds are not going to recover the same in the same way that Carol at 40 was going to. So, the MD guidelines help you understand how long that normally would take for someone of a 79-year-old to recover from that type of injury. Helps you frame things up. So WCB are using these. Tier 1 service providers are using them. I think they're a really rich source of information. And, if you don't have something like that you might want to consider this one. The other piece that helps with cooperation is this approach that WCB caseworkers are using, and I think it would be really helpful for you with respect to duty to cooperate, is starting with the voice of the worker. So in our example, you were Carol, and Carol could look at those duties and yeah, I could do these too, but I can't do these ones yet. So, bring the worker into that conversation. What can they do, right? What parts of their pre-injury job can they still do? Have that conversation. That's what WCB is doing. They're talking to the worker. Then they're bringing the employer in and saying, hey, with your expertise, this is what the worker thinks they can do. What do you think? Can we make that work? The caseworker will mix them together in creating a return to work plan. And then, this is a really cool thing, because sometimes we hear about healthcare providers who, like, they're blocking return to work. The doctor says they're off work for 6 weeks and I can't do anything. What WCB has been doing, and you can too, is talk to the worker, look at who's the supervisor on the floor. Can you put together a return to work plan? And what WCB does is they send that plan to, whether it's the physiotherapist, a chiropractor, or a doctor, and says, hey, we've developed this plan with the worker and employer. Everyone is comfortable with it. We're going to start on Monday unless we hear from you that there's a risk of harm or safety concern. Otherwise, we're moving forward. So that's a new approach WCB has been taking on claims. It's been very successful in moving return to work forward. So it's something that you can use as well, and it helps you meet the duty to cooperate. Win-win. So when we, like, a return to work plan is better than no return to work plan. Almost always, but not always. So a return to work plan really needs to be reasonable. And I will say the biggest part of that is the safe part of early and safe return to work. Okay. So you want a start date that begins as soon as safely possible. You want an end date within that disability duration guideline, right? And again, you have to be willing to adjust it. As much as possible, connect the worker to their pre-injury job. Okay. The functional abilities and respecting functional abilities, I should have highlighted this. This is the safe part, right? Do you need to have a functional capacity evaluation to do this? No, you don't, right? But there comes a time when there's some types of return to work where it's very, very specific weights or repetitive movements. You may need more help, but for the most part, for sedentary duties, you don't need to have a functional capacity evaluation or even a functional report. The worker, if it's a sprain strain, let's start sedentary, and before we move higher, we get, more functional information. If the worker is not in their pre-injury job, then their return to work plan should progress them to pre-injury. So it's really hard. For example, I've seen lots of cases where an employer says, yeah, I can bring the worker back to work. They're going to be an extra. They're going to shadow somebody else. And basically they're doing sedentary work for 8 weeks. And then at the end of 8 weeks, they're expected to be able to do medium work. Well, the chances of jumping from sedentary to medium often doesn't happen. So the worker is gaining function throughout that 8 weeks, and hopefully the return to work plan reflects that. So you want to progress toward pre-injury, and you want to make sure that there is, if the worker could do their full hours. So sometimes the worker could do their full job, but only for 4 hours. Well, what could they do for the other 4, right? How do you fill them their full pre-injury hours? Because that helps them with their pre-injury earnings. Duty to cooperate. How about that? And the final piece, and this is where a lot of the plans that I've seen coming in from employers don't include this part, and it's really important, is what's the monitoring of the plan going to be, right? What does that look like at the workplace? And then WCB is going to want to be monitoring things too. But what's the workplace check-in, right? So how are you going to know if that plan is on track or off track, right? And I've heard employers who didn't know, hey, after 2 days, the worker was unable to continue in the plan, and they didn't know until timesheets were put in, like within a couple of weeks. Well, that doesn't work. You need to be able to adjust. So who's the worker going to talk to the first few days, every day for the first few days of their plan, right? How are you going to know that the plan is on track and everything is going well? And that helps you meet the duty to cooperate, right? By having that ongoing communication and sharing information. All right. As I said, pre-injury is really important. That's the job that you hired the worker into. So that ideally, you want the worker to do as much of their pre-injury work as possible. There are times when it's not going to be possible. I fully recognize that, and it might not be possible right away. There may be very, very safety sensitive things. There may be bona fide occupational requirements with respect to safety, like particularly for workers who are working offshore. There are those, okay? But still, are there any parts of that pre-injury job that you can keep the worker connected to? Start there and then, kind of fill in the rest of the hours if you need to. If you can't do pre-injury, is there a job vacancy that the worker could do? Because that actually, it doesn't happen very often, but when it does, it's a sustainable thing. Like, it's really hard. You're not required to create an extra position, right? You certainly can, especially for a short-term period. It probably is beneficial to do that, but you're not expected to. So it's much easier if there happens to be a job vacancy that the worker could fill that in a short period of time. That could be a win-win for everybody. But again, how do you get them back up to pre-injury? So start thinking about pre-injury, and then if you have to, start moving down. Transitional duties are great. These are what I would call a bundle of duties. I'm from Newfoundland. We would call them a hobble, like a bunch of small pieces, like, do some training, help us with inventory. You start pulling together this bundle of duties. That's great in the very, very short term, but that's not sustainable over the long term for you. And long term, even a month is long term. It's hard to keep that going for a month. And what if you have multiple people who are injured? Those are difficult. They're very, very useful in the short term. But again, if you can get the worker back to pre-injury faster, that's really good. And if you can't do any of that, then keep the worker connected to the workplace. How could you do that? Well, could they keep their email and stay on emails? Is there a tailgate at the construction site every week that they could attend to keep up to date on what's happening? Do they have a coffee buddy? Could they go for a coffee break once a week to keep up to date with what's happening? Having a phone call with their supervisor once a week while they're off work, keeping that connection is really important, and it also fulfills the duty to cooperate. All right, the different sedentary, light, medium are in your package. That package the link that you have will be available on the Duty to Cooperate website. Tracy and Katie will tell you all about that later. So I'm not going to go into this very much, but I will say, like for Carol, even though her highest level was medium, there were sedentary work duties there. There were light work duties there. So you can actually adjust to that. And if you have a good return to work plan template, that actually can help you meet the duty to cooperate legislation. So in your package, I've done up a return to work plan for Carol, and I'm using the template that WCB is using. So right now that still says timely and safe return, TSRTW, because the legislation came in with new terminology and WCB is still updating things before July 15th. So bear with us. But this is a return to work plan template that WCB uses. You are not required to use it. You may have your own. But what you want to do is have a look at your own and see, does it help you meet the legislation? So if you look at this Carol sample plan I think the bottom of the third page, there's actually a communication plan so that Carol is going to have a call with her supervisor at the end of each day for the first week. Then they're going to do some texts. Then they're going to meet once a week. The caseworker is going to call. That communication plan really helps you meet the duty to cooperate legislation. And the section that is the return to work calendar helps you with suitable and available work. So it helps you define what it looks like. It enables you to progress to pre-injury. So you don't have to use this template, but I recommend that review your own return to work plan to make sure it has the elements in it that help you demonstrate that you're meeting your duty to cooperate. So that's great. Is it really realistic? Yeah, it is. The majority of WCB lost time injuries are sprain strains, right? We are talking about disability duration guidelines of 2 days. The maximum one in there is like 90 days, and that is for very heavy work. Like you'd have to lift 100 pounds and with a very significant sprain strain. So for the majority, these are a few weeks in length. So it is very, very doable for those. And if you keep the easier, and I don't want to diminish any injury, because for the worker, we could say, oh, it's only a sprain strain, but that could be quite devastating to that person. So I don't want to minimize that. But if you keep the ones that should be simple, then you'll have time to work on the ones that are a bit more complicated, where the worker has to have surgery. There's multiple body parts. They're not catastrophic, but they're going to take longer. And you want to give yourself the room for that. But what I will say is that time off work extends disability. The chances of the worker recovering and returning to work diminish the longer they are off work. I can send you, if you want the links, I can send you a bunch of links to all the research that will tell you that. We know that. But use those normal recovery times, adjust them as needed, and you know, if you already have a third-party disability management provider, you have an occupational therapist or a physio clinic that you work with, involve them in this. Like, they are the expert. They know how to do this, and keep the simple things simple. And then it's very, very realistic. All right, a couple of myths, because we said we were going to bust them. Oh, here we go. Rapid fire. As an employer, I will be ready for duty to cooperate if I have a strong return to work program in place. Yes, you will. Absolutely. A strong program helps you meet this duty because you already have the expectations built in for injury reporting, having those conversations, working together with your worker on a return to work plan, and providing information to WCB. Easy peasy. Okay, yes, you will. All right, busted. I have to wait for a WCB claim to be accepted before early and safe return to work can begin. Oh my gosh, no. If you do that, you are losing out on time. You know your own workplace. Think about Carol. She was back to work, right? In the first instance, the workplace parties are the best position to do return to work. WCB will help you if needed, but you don't need to wait for WCB claim to be accepted. This is still your worker, whether it's WCB or not, and you want to get them back to work as quickly as possible. So no, you don't have to wait for WCB. My worker must be at 100% before they can return to work. My gosh, I have heard this so many times. I will tell you, I don't know who was at 100% before they were injured, and not sure how they're getting back to 100% before they could go back to work. But with the right accommodation, then everyone can go back to work. Even folks who have that bona fide requirement, right? Like people who work for Coast Guard, for example, to go offshore, they have to meet a certain physical standard. Okay, is there sedentary work on shore? Is there something else we can do? So no, you don't have to be 100% before you can return to work. I'd love to be at 100% and I'm not injured, so I don't think that's a requirement. The duty to cooperate requirements will not be difficult to implement if return to work conversations are happening. Yeah, that's true. If you're talking to each other, you're talking to the worker, you're talking to WCB. Here's the ones I've seen, honestly, where employers I think might run into trouble when the caseworker calls and the employer says, no, I don't have anything, and then they'd stop returning phone calls. That's going to be a problem, but it's not going to be difficult if return to work conversations are happening. All right, written functional abilities information are not needed before sedentary return to work can start. Well, that is true. They are not needed. Sedentary is very safe unless someone's in hospital, right? Or they have gone to the emergency room and they've given them some kind of, you know, drugs that knock them out. You don't need functional ability information before sedentary. You probably do to move it up to, you know, more lifting and light and medium, but sedentary is activities of daily living. What I've often said to WCB workers is if someone can't do sedentary work, we need to be starting to talk about how are they, do they need home care? Like how are they actually functioning at home? There's nothing that I can do when a caseworker isn't getting back to me quickly. Oh no, you keep on moving things forward, right? I mean, I really hope that this isn't happening anymore. WCB is working really hard on making sure caseworkers are getting back to folks quickly. But when it doesn't happen, you can move forward. Like I said, I showed you before, have a discussion with the worker. You, as the employer, bring your expertise, create a return to work plan. And the worker can, you know, fire it off to the worker's doctor. The worker could take it to their doctor and again say, we're going to start on Monday, unless, you know, there's a safety concern or a risk of harm. So no, you can keep moving things forward. Oh, duty to cooperate means I have to make a new position. No, it does not. It's suitable and available. So you do not have to make a new position in duty to cooperate, but you can be very creative in some temporary solutions to help your worker recover at work. But you do not have to create a new position. I don't need to wait for my caseworker to start a return to work plan with an injured worker. Well, I hope you've got that one down because no, you do not. Please don't. You wouldn't do it if it wasn't WCB. It's your worker. It's your workplace. WCB is there to help. And but you know, you do not need to wait for your caseworker to start a return to work plan. If the worker has been involved and you followed all that plan is reasonable and safe, right? So, and the worker is a really good judge of their own abilities. But again, I wouldn't start one that is beyond sedentary until I got some functional abilities information or verification from the caseworker that they've got functional abilities information. So you do not need to wait. All right. I hope I have busted some myths. I am going to turn it back over to Tracy, I believe, and then we can get into a Q&A after that.
Thank you, Val. That was excellent. Every time I hear Val speak, I learn a little something different. So I hope that you were able to take some good tips away from that. So one of the pieces Val talked about was the importance of having a good return to work policy or program in place to support your readiness for duty to cooperate. We've heard over the course of the webinars that folks would like to say, like, is my policy good? Is my program good? So to support questions and those kind of inquiries, we've set up a new service offering called Virtual Office Hours. And you can see a QR code here where you can actually book a 30-minute consult with one of our workplace consultants that work on the team who are very well positioned to support the review of your policy or your program, to pose questions and offer you things to think about in advance of duty to cooperate. Those options are open now, so do take a picture of the QR code and you can get yourself set up with a 30-minute consult with one of our workplace consultants. The other piece is we've heard loud and clear that you need some resources to support conversations with your employees, and you would like some simple information to help you understand how do I get ready. So launching early next week, we have a couple of new fact sheets being offered, one for workers and one for employers around duty to cooperate. So stay tuned for those. Those will be up and running on our Duty to Cooperate website next week. So as Val talked about, you don't need to wait for policies to be released. You've seen the draft policy. Following today, what we want you to do is to get involved. Book a meeting with a workplace consultant, take a look at your your policy or procedure, and get ready for duty to cooperate. Join our next webinar on June 19th when we'll go through the policy pieces specifically. You can start to explore our Working to Well resources, the employer toolkit on our Duty to Cooperate website and our WCB website. I think all of the links have probably been posted in the chat. Get creative. Think about those solutions that Val was encouraging you to think about. What can they do today? What parts of their job can they do? How do you keep that worker connected to make sure that they have that ongoing relationship and work connectedness to support return to work? So that's it for the formal piece. We have about 10 minutes for questions and answers. So Val, I'll get you to come back on, and Katie, and we'll turn it over and be ready to answer.
Okay, and I'm going to spotlight both Val and Tracy here. So we had a lot of questions in the chat. And actually, Val, good news, when you were doing the scenario on Carol earlier on, I know you can't see the chat box, but you were asking, walking through it and, okay, what kind of functional duties would Carol be able to do? We had a lot of input on that, and people were hitting it out of the park, which was great to see. So we do have some great questions, though. There's a clarifying one for you, Val. You mentioned earlier on in your presentation that when there is a workplace injury, that the best thing for an employer to do would be, along with the injury report, to maybe come up with a return to work plan right then and there, get it started right away. Someone had a clarifying question over, don't we need some functional information, though, about the worker to determine that return to work plan? So would it even be feasible to create that return to work plan with the injury report, or don't we have to wait a little bit to determine their functional abilities?
Yeah, so what I would say to that is it depends on the nature of the injury. For the majority of the cases, no, you don't need functional information for sedentary work. And if you are involving the worker, they can certainly share, what they can do as well, right? So if the worker is like, yeah, like Carol, yes, I can do these two things. I'm not comfortable doing the rest of these. I haven't seen physio yet. Okay, those are both sedentary. Let's do those for a few days, and we'll plan the full 21 days, but we're going to adjust it until we get your functional information. Now, if you have an injury that is more complicated than a sprain strain, yes, you could still do sedentary, but you really want some strong functional information before you get people to start lifting. For example, increasing their lifting tolerance, their range of motion, all those things that will be measured in a physio clinic or, by a physician, right? So yeah, you can get started in sedentary, particularly on sprain strain injuries, and with the worker's involvement. If the worker's not involved, that the duty to cooperate falls down, right? Number one, because the worker needs to be involved in that. But yeah, if in the majority of sprain strains, you could get started in sedentary work.
And Val, I like how you're mentioning sedentary work right now because it's either Rhea or R-E-A, Rhea, I believe, had a question. What if a worker has a doctor's note giving them 2 weeks off work because of their workplace injury, but there's no reason that they can't be back to doing sedentary duties? So maybe we could expand a little bit on who determines the eligibility for those types of duties. The employer thinks, hey, this worker can certainly do sedentary duties, but they've got this doctor's note saying that they've got 2 full weeks off work. What do you do then?
So as I said, the approach that WCB is taking, and I think this will certainly work for employers as well, is if you're working with the worker and asking Carol, in our example, what she can do, and she's listed 2 things that she can do right now, and you as the employer go, yep, we can make that happen. Let's develop a return to work plan. Then even if the doctor has 2 weeks off work, I would send that back to the doctor with, we're going to start, Carol is on board. We're going to start this on Monday, unless you tell us that there is a safety risk or a risk of harm to Carol to do this. So that's what WCB has been doing, and it's been very successful in it because, again, the 2 weeks off, that's very, very typical. Sometimes it's a lot longer than that. But think about Carol. Her disability duration guideline was 21 days. Like 2 weeks for sedentary, for sprain strain, no. So I would develop the return to work plan. And again, if you need assistance with that, all the more reason to get your claim into WCB really quickly, because the caseworker can also help in having those discussions or sending those messages to a care provider.
That's great, Val. And I like the emphasis there on having that constant dialogue with the health service provider to go back and say, well, wait a second, we think they'd be available to do sedentary duties. Carol's on board with that. What do you think? Tell us no if it's no, but hey, what do you think? I like the emphasis there on having that consistent dialogue with the health service providers as well.
You probably don't want to, sorry, just to clarify, you probably don't want to ask them what they think. What you want to ask them is a very specific question is, Carol's on board, we're on board. Unless there is a risk, there's a safety concern or a risk of harm, we are going to start this plan on X day.
Yeah. We're full steam ahead.
Right? Yeah, because physicians, in Newfoundland and Labrador, which is where I come from, and I had been working with the medical school there when we were implementing this, they get 4 hours of occupational medicine, right? For a GP now, maybe it's different in Nova Scotia at Dalhousie or what have you, but they don't get a lot of occupational medicine training. So you got to be really careful of the question that you ask, because they also don't have a lot of ability to do a whole bunch of functional testing in their office as well, right? But again, we're talking about sprain strains for the most part here.
Exactly. We had a question, and this I think actually pertains a little bit more to actually finding suitable and meaningful work, because someone said, well, what if a worker, they do want to come back to work, but they want to work in an entirely different part of the workplace that they just aren't qualified to work in? What do we as an employer do then? And I think this is a good time to talk about the employer's responsibility to find them suitable work.
Well, that's right. I mean, suitable work has to be work that the worker has the skills and ability to do, right? So the ability is their functional ability, but you have to have the skill level. So when you're talking about during recovery, and again, recovery period for sprain strains, you're looking at weeks. There are other injuries that the recovery period is longer for, obviously. So you're not expected to put a worker in 2-week retraining program to do, 1 more week of a return to work plan. Like that doesn't make any sense. They need to have the skills to be able to do those pieces. One of the things I have heard from, and so if you're an employer on the line who is in a situation like this where you have different locations, it's like, oh, sorry, you're in the lumber yard, but you can't work in the retail store. So it's like, so as an employer, you're the employer. So saying just no to all the light duties, all the sedentary duties are probably in the store, in the retail store. But, as an employer putting up that barrier and saying, sorry, the lumberyard people don't work in the store, without really exploring it, because, your worker might have some skill there, existing skills. Maybe they could work in the store for 2 or 3 weeks while they're recovering. So just don't be open to looking beyond, a particular department or location if you have multiple locations. Now, again, you're not going to send a worker 4 hours away. Like, reasonable is important. But yeah, try to be as flexible as you can in suitable work. But yeah, there's no expectation that you're going to retrain somebody or put them in a skill program. But you know what? If it's a couple of hours, that might be very reasonable. And as an employer, that might be your best option. But are you required to do that? No.
And this might be more of a question for you, Tracy, or even, I hate to put him on the spot, but even Kevin, perhaps. We had a very quick question on, do employers need to accommodate non-work related injuries? And I will just say, Kevin did briefly answer this in the chat, and he said a non-work related injury would be outside the role of the WCB. But yes, employers do have other accommodation responsibilities, such as human rights. And we had a couple of questions related to this, non-work related physical injuries, busting your knee at a soccer practice, let's say, or non-work related like mental health injuries that have happened outside the workplace. Do employers have a responsibility to accommodate that? Kevin said yes, but it's kind of outside the scope of the WCB. Tracy, did you just want to kind of elaborate on that a little bit? Or maybe for Kevin?
And Kevin, you feel free to jump in. So there's lots of pieces of legislation outside of workers' compensation that employers are required to follow. Human rights would be one of them. And there's some defined guidelines around accommodation under that legislation. We are definitely not experts in that here at the WCB. We are experts in the WCB legislation, but employers have obligations outside of workers' compensation to cover non-occupational injuries and accommodations. Lots of folks out there that can help you navigate that if that's something that interests you. The reason we're using those examples in today's webinar is to draw your attention to that you probably do it really easily if someone did hurt themselves on a ball field, and you can apply those same principles when someone is injured at work for that early and safe return to work. That's the only reason we bring up those non-occupational injuries, to just draw the comparison, to say that don't let just because it's an occupational injury, don't let that get in your way of good return to work planning at the beginning.
That's great. And actually, I wanted to circle back to something here about the worker side of things. We had a couple of questions all kind of around the same theme here of, and we've had these questions before, and I think it's good clarification, what if we are ready to accommodate? This person in particular used an example of providing sedentary duties. So the employer is all ready to provide sedentary duties for their worker to come back to work, and the worker claims, I can't do it. I'm not healed. I'm in too much pain. I can't do sedentary duties. What do we do then? And I'm thinking that might be a good time to kind of elaborate on the worker's responsibility as well in return to work. Tracy, that might be more of a question for you, unless Val, you have some thoughts on this too.
I'm going to let Val.
I have thoughts on everything. For it. So yeah, no, it's tricky, right? And I always try to put myself in the position of a worker who's been injured. We had one today. Actually, a caseworker was asking me, the 68-year-old, first time they had ever been injured, 68 years old, and they were embarrassed, in pain, mortified, like all these things. So sometimes there's other things that are happening there where the worker is saying no. So first of all, maybe it's not a cooperation, maybe it's a communication issue. WCB can help with that, right? Like your caseworker can help you with those conversations with workers. What I would say though is when you have a good return to work policy in place, it sets the expectation that you are going to be going back to work while you recover. So it's way easier to have that conversation with your workforce before there's an injury than when you bring in all of those elements of injury into the question, right? So if you have that case where the worker is just like, no, then WCB case manager or adjudicator can certainly help with that, to help the worker understand their responsibilities under the duty to cooperate and enable them to come into compliance to mitigate their own loss, right? To help their own recovery at the end of the day. But yeah, sometimes that is a challenge. And if the conversations at the workplace aren't kind of moving that worker, then conversations at WCB or with tell the worker, talk to their physician, talk to their physio provider, right? They can also help educate the worker on the benefits of recovery at work, and that being in pain is not necessarily a barrier to return to work in and of itself.
It's great clarification. And actually, we've moved now into the extra 15 minutes we have in the agenda to handle any questions from the continuing care sector. So if you are a member of the continuing care sector and you have some questions related on duty to cooperate in the accommodation process, by all means, pop them into the chat there. And in the meantime, we can also use this time to just sift through some of the additional questions that we've had. I'm assuming a lot of the questions might be one and the same. We did have a question, Tracy, a few around unions and the union's role in duty to cooperate. So I will just mention one of the questions off the top was, how do we accommodate in a unionized environment where roles are very clearly defined? And we've had similar questions like this before on the union's role when it comes to duty to cooperate. Kevin did mention that the unions have been clarified in our draft policy. So I didn't know if we want to add anything to that, Tracy or Kevin, again, to put you on the spot. But I thought we could just add a little something there because we did have a few questions on the union's role.
Excellent. I'm happy to address some of those. So we know that in unionized environments, I've been visiting a lot of employers, and this comes up as a consistent that it's a real challenge around return to work, and sometimes in the perceived barrier that unions create. So what we've done is we've actually been in touch and working with the Federation of Labor, and through them reaching many of the different unions to have conversations about what is their role when it comes to duty to cooperate and return to work. And the unions, as we chatted with the organized labor, they're all very supportive. They actually really feel like they can be an assistance when it comes to return to work. They want to be part of the return to work team, and they can be a vital role. They can help support the worker that's injured. They can help support the employer, and then they can also help support the other members or co-workers that are questioning, why is this worker doing something that's not their full role? So the unions can be a real part of the creating a early and safe return to work. We've had great conversations. We're creating some fact sheets for the unions to use with their members to help us spread the good word that early and safe return to work is healthy and that recovery at work is really important. So they're engaged in the conversation. They want to be at the table and they want to be a partner.
Great. Thank you, Tracy. And Paula, early on in the presentation, had a quick question. She said, is there a limit to return to work plans? We could have 2 work-related injuries. We could have 2 non-work related at the same time. Is there a limit to the amount of plans that we have to create?
For one worker or just for like multiple workers at the same time?
That's a great question. Paula,
well, so if
you're still here, feel like you want to clarify that in the chat, by all means, go ahead.
Yeah, what I would say is the duty to cooperate applies to each individual worker, the way the act is worded, like it talks about the worker, right? So yeah, if you have multiple injuries, you could have multiple plans going at the same time. That often happens, like especially for larger employers, but yeah, you could be running several at the same time. I would say if the situation is one worker with like, oh, they have a non-work related thing and they have a work related thing and they have something else, it's really difficult to manage, oh, we're going to kind of separate the work related and the non-work related because it's the same person, right? And so if there's multiple things happening, you want to make sure that they're coordinated in your plan for that one worker. But yes,
and
you can have multiple plans.
Paula did clarify, Val, she meant multiple workers at the same time.
Yes. Yeah, the duty to cooperate applies to each individual worker. So you would have multiple plans going at the same time. That's why health and safety is really important. But realistically, many of you are going to experience that if you're large. You're going to have multiple plans at the same time.
Okay, and we do have a question on the continuing care sector from Heather McDonald here. Now I'm going to read it. It's a little lengthy. I'm going to read it word for word just so I don't mess it up, Heather. What if a CCA employee has been determined to have a partial long-term disability and can only give 20 hours of work per week? However, the worker is not able to provide CPR safely, so the agency has to have someone shadow this worker to work in client homes. So then we need to have 2 workers for 1 visit. Heather says, we're already attempting to provide other options, but it's not expected that the CCA will recover to be able to be on their own in the field. Did you want me to read that again? I know that was a little lengthy, but it was very scenario based.
Yeah, no, I think I got it. I mean, it's unusual. It's not the majority, right? Number one. So yeah, this is one where you'd need to spend a bit more time because it does get a bit tricky. So if the nature of the injury is such that the worker is going to have a permanent impairment at the end and they're not going to be able to do their pre-injury job, right? Then you obviously want to continue that cooperation during recovery to the best of your ability. And it is suitable work that is available. So having an extra worker may be very, very helpful in the worker's recovery, but you can't keep going forever and having the worker do that, right? That's not the requirement. And then the reemployment obligation would kick in at some point when the worker has reached maximum medical recovery and you're trying to figure out, well, now what's the permanent situation with this worker and how do we accommodate them? Yeah, so I would say if there's a partial long-term disability, and I'm assuming there's a new injury that's now being accommodated. I think that's what Heather was saying. And now the worker is a shadow worker. Yeah, those are good for temporary, but those aren't sustainable. Like you can't have an entire shadow workforce, but they're really, like, again, they can be really helpful in a short-term situation, but it falls apart pretty quickly. Because it's not available then, right?
Right.
Yeah.
And actually, Val, this is a good opportunity to clarify. You mentioned something just a few moments ago about employers should not feel like they have to create new work. Caitlin Ulrich had a question just a few moments ago. Are employers seen as not meeting their obligations under duty to cooperate if there just aren't many sedentary duties naturally available for their employee to do? And then Caitlin says, often there's a strong encouragement for the employer to find work where it just doesn't exist. And so we've had those questions before where employers kind of feel like that pressure to find work when there really isn't anything necessarily for that employee to do. I thought you could expand a little bit on that. Employers shouldn't have to feel like they have to create net new work just for the sake of it.
That's great. That's true. Legislatively, they wouldn't have to do that, I would say. I mean, Kevin would probably, be able to, or Tracy's team, when they come on board, will make those determinations. But it's advisable in a short term. Like if you're talking about for 3 weeks, can you do it for 3 weeks to facilitate someone's recovery? Could you be creative and do that? The other piece I will say is that even with employers who say, like, this work is very heavy, I'm like, okay, but when we actually break it down, there are pieces of sedentary work in there. So, look at the job and really start to look at, are there pieces of it that could be sedentary? Again, think about Carol's injury. She had a lower back. It's a 21-day recovery period, right? So again, if you can pull together those, like some employers do bundles of duties, transitional duties, but try to look at the pre-injury job and see if there's parts that the worker can do. Don't just dismiss it because, oh yeah, it's construction, it's very heavy, or oh no, this worker has to do heavy work. There may be pieces that are sedentary. There may be training, and that is part of the job. Like maybe instead of doing your certifications for online updating your training, instead of doing that in November, maybe you're going to do it now because you can do it while you're recovering. So it is part of the job, right? You're not creating work. You're just rearranging the timing of the work. And one of the other pieces, and I didn't mention this, but I will now, is there's the duties to the work, but there's also the engineering of the work. So thinking about how the work is done, right? Like can also lead to different accommodations. We had one in Yukon where the worker had a shoulder injury, couldn't do any over shoulder work. And it turned out it was just the way the warehouse was done. Like all the heavy stuff was up high and the lighter stuff was down low. And it's like, well, if you put the heavier stuff down low, they can actually move it much, much easier than reaching up to do it. And so they rearranged the warehouse. Not only could they accommodate that worker, but it reduced injuries because people weren't pulling the heaviest stuff off the highest shelf. It was just the way it had always been done. So when you look at things differently or think about assistive devices, like what is available today is amazing. And I love the Job Accommodation Network. It's an American website, so we'll take that for what it's worth at the moment. But if you go to askjan.org, so askjan.org, for almost every job, it can talk about like these amazing accommodations, right? Like a sit-stand stool is like $100, and it can be a game changer for retail workers, for example. If you look at folks who drive, like hand controls, people think hand controls are really, really expensive and really hard. Oh my gosh, there's such new technology. It's almost like a gaming console that people can learn really quickly. And all of a sudden it opens up a whole bunch of accommodation they didn't even know was there. So that's a very long, circuitous way around to say you don't have to create, but it might be in your best interest to start looking at that and be creative in doing so, because you don't always have to look at, again, job duties, yes, pre-injury job duties, break it down. Look at training, look at other pieces of the pre-injury job that might not be timed with the injury, but could have to happen at other times. Like, at the end of the season, there might be things that get done that could be done a little bit earlier and the worker could do them and they're sedentary. And then look at engineering in the workplace. And I'm not talking about like, retooling your entire workplace, but sometimes just reorganizing how the work is done can change a medium task to a light task. And all of a sudden you have a return to work in place.
That's a fantastic answer. And I like how you talked about, when we speak of accommodation, it's also about just maybe like rewiring the way that their duty is done. You gave that example of the person who couldn't necessarily reach overhead, but they were okay to reach from down below, right? So little like adaptations like that can go a really long way. I think it's a really great way of looking at it. And just speaking on that, on return to work plans, Paula Jodry had a question. Can the return to work plan be 4 hours per day instead of 8 hours if we just can't find sedentary duties? Is there flexibility there?
Oh gosh, yes. 4 hours is better than no hours. Like really, I mean, ideal, but you want that 4 hours to build back up to the 8. So if you have a 3-week plan, like for Carol, if it is 4 hours, then you need to move it to 6 and then get it to 8 or jump right to 8. Like don't leave it at 4 for 3 weeks, because then getting from 4 to 8 is probably going to be a jump, right? So yes, you can, if that's what you can do. But if you can get full pre-injury hours, like oftentimes there's no reason the worker can't do 8 hours. It's just they can't do 8 hours at their pre-injury job, right? So if you can fill the time, great. Sorry, Tracy, go ahead.
No, that's okay. I was just going to say, I think sometimes when folks start with a 4-hour plan and sedentary duties, we forget that sometimes recovery is happening while they're at the workplace. So their abilities are going to build. So that return to work, can you talk a little bit about how you revise that plan as you go based on their recovery at work?
Sure. And so to start with, what I would say is I would always start with a plan from beginning to end, even if I'm not 100% sure of how it's going to go. I always look at the disability duration guidelines. And so for Carol, in the sample plan that I gave you, and she got injured last night. No, went Tuesday night. Today's Thursday. She's come back to work. So I developed a plan that looked at a progression like, getting from 20 to 50 pounds. So 20 pounds, 35 to 50, because healing is happening. And then that's where the communication plan comes into play, where you start to, how are you feeling? Is it working out well? At WCB may get more functional information that helps with that progression. But I try to make sure I go end to end, and then depending on how long the plan is. If it's a 3-week plan, you probably want to look at it in 1-week blocks. If it's a 3-month plan, you might want to do 2-week blocks. But I would block all that out. And if it's a lifting progression, just, start, 5 pounds a week up to 10 pounds a week, because for sprains and strains, they're going to heal if we did nothing. Now they'll take longer without, recovery at work makes it happen faster and stronger, but that person is going to heal. Healing is happening. You can do that. And then as you get more functional information, then you can adjust with the worker, right? Adjust the plan, adjust the end. Like maybe Carol's going to take 28 days. Maybe she needs another week. You get her to 6 hours. She's, not ready to go to 8. Okay, Carol, let's do another week and then we'll get you to 8. But open-ended plans end up running long. And that's where a lot of times employers get frustrated because, I could do these extra duties. Like I could have a shadow worker for 3 or 4 weeks, but I can't have her for 3 or 4 months, right? So you want to make sure that your plan has a beginning and an end, and that worker is progressing to duties toward pre-injury, hours toward pre-injury, and depending on, again, how long it is, if it's on a weekly basis, just make sure it's, if you're going from 4 to 5 hours, right? 4 to 6, you're adding a duty in each week, right? Like, so in Carol's plan, I started with sedentary duties for the first week. I added in the light duties for the second week. And then I upped the weight of the light duties for the next week. And then she should be back at full. And we're going to evaluate that plan. You'll see in the sample every week. So we can, if we need to adjust it and maybe we need 2 weeks at 35 pounds. Okay, let's do that, right? But what we don't want is 2 months at 35 pounds, because that's something that you want to discuss with your caseworker, because healing should be happening, and something is, if progression is stalled, there's something going on, and your caseworker can dig into that with the service provider, if the worker's in physio, or with their physician, to find out what's happening and why that's stalled.
That's excellent. Thank you, Val. It's extremely informative. And that actually brings us to the end of today's presentation. So yeah, I got to say, I was like, this has probably been one of the most informative presentations we had. Val, I think you did a fantastic job. You answered a lot of great questions. You gave a lot of really great tips and tools on how to best look at accommodation and like you said, getting creative with it, right? So that brings us to the end of today. And I want to let everybody know that I will be sending out I guess you would call it a wrap-up email early next week. That's going to have the webinar recording as well as a link to our frequently asked questions. They're already available on our Duty to Cooperate page. And it's also going to have our handouts for employers and for workers on Duty to Cooperate, and a whole bunch of other little things as well. So it'll be a nice wrap-up email with a little bow on there. So if you missed anything from today's presentation, if you have a colleague who wanted to come today but wasn't able to join, we will be sending that out early next week. Make sure you hop over to our Duty to Cooperate page to check out the FAQs, because they are on there. And thank you again for everybody who always takes time out of their day to join us, to ask questions on Duty to Cooperate. It's coming up. It's hard to believe that it's almost June, and just a little bit over a month from now, July 15th is when it comes into effect, and we will be ready. So thank you, thank you, thank you. Thank you to Val for joining us today and leading a fantastic presentation, and to Tracy and to our whole team, but especially to you guys, like I said, who carved time out of your day to come and ask the questions that need to be asked. So thank you so much, everybody, and go enjoy the rest of your day, and also stay tuned for that next webinar invite for June. See you guys later.